about a phase 2 study, not a randomized trial, but a phase 2 study exploring lower dose intensity modulated radiation therapy, or IMRT as it's called, for patients with HPV-associated oropharyngeal cancer, focusing on clinical outcomes as well as long-term effects. Dr. Anthony Cmelak, a professor of radiation oncology from Vanderbilt Ingram Cancer Center, will be presenting this.
Good afternoon. ECOG 1308 was based on a predecessor study, a large phase 2 study looking at patients with larynx and oropharyngeal cancers as an organ preservation approach using induction chemotherapy with paclitaxel and carboplatin for 2 cycles, followed by concurrent chemoradiation to full dose at 70 gray. What we found in this study was that patients with HPV-associated cancers had a markedly better response rates to induction chemotherapy as well as overall survival to the entire regimen, with a 2-year progression-free survival of 86% versus 53% for patients with non-HPV-associated cancers. What we also found was the patients who had HPV-associated cancers were much younger, tended to be non-smokers, and would carry long-term side effects for a much longer portion of their life, perhaps 30 or 40 years. These include hypothyroidism, swallowing dysfunction, xerostomia, dental problems, and an increased risk of stroke. These are all due to high doses of radiation. Based on E2399, we designed this large phase 2 study looking at induction chemotherapy with the addition of cetuximab to platinum and a taxane, evaluating them clinically for a complete response, and those who had complete response were able to go on to receive lower dose radiation of 54 gray using IMRT with concurrent weekly cetuximab. The hypothesis was that we, using lower doses in these good responding patients, could alleviate the long-term side effects of radiation while still maintaining approximately 85% 2-year progression-free survival that we saw using the higher doses of radiation on the predecessor study. The results showed that the toxicity was very mild. Patients in general had very few grade 4 toxicities, and only one patient had 1 grade 3 toxicity long-term, and that was low magnesium at 30 months in 1 patient out of the 80 enrolled. The 2-year progression-free and overall survival rates are shown here. What it showed was that in all patients, all 62 patients who went on to receive low-dose radiation, their 2-year progression-free survival rate was 80% with a confidence interval of 0.7 to 0.88, with a 2-year overall survival of 0.93. The patients who were non-smokers had the best outcomes, as you can see down below, and in patients who had non-bulky tumors, less than T4, and no contralateral lymph node involvement, the 2-year progression-free survival was 96%, and 2-year overall survival was also 96%. Looking at the patients who did not develop a complete response to induction chemotherapy, who went on to receive full-dose radiation, their 2-year progression-free survival was statistically lower at 65%, and 2-year overall survival of 87%. In conclusion, low-dose radiation after complete response to induction chemotherapy resulted in a 2-year progression-free survival of 80%, which fell between the confidence intervals that we anticipated based on the predecessor study and was consistent with our hypothesis. Patients with a minimal smoking history, less than 10 pack years, which was approximately 2/3 of the patients, did exceptionally well with a 92% progression-free survival and a 96% overall survival using just 54 gray radiation. Chemoselection strategies are worthy of further study in this patient population with HPV-related squamous cell carcinomas of the head and neck. And it potentially allows a significant reduction, 23% reduction in overall radiation dose, and decreasing long-term toxicities associated with that. It potentially represents a new paradigm in the select group of patients. Thank you.